Methods of oral care. Introduction to the module. In this module, you learn about the methods of taking care of your teeth and ensuring a good oral hygiene practice, the proper techniques of brushing, flossing, and also about oral irrigation and basic lifestyle practices to ensure good oral health. Topics to be covered. Determine your weak points. Brushing and flossing. Brushing techniques. Base brushing technique. Charter's brushing technique. Modified Stillman brushing technique. Rolling stroke brushing technique. Phones brushing technique. Tongue brushing. Benefits of flossing. How does flossing help your gums? How to floss. Choosing the right toothpaste. Types of toothpaste. Using a mouthwash. How to use mouthwash. Oral irrigation. Lifestyle practices. Determine your weak points. Lasting changes start with small and manageable changes rather than complete overhauls. So, give yourself some time to sit down and honestly determine which of your oral hygiene habits are the weakest. Asking yourself these questions might help. Do you sometimes forget to brush your teeth? Do you skip flossing very often? Does your sugary diet undermine all the hard work you do when brushing and flossing? Does your smoking and consumption of alcohol affect your oral health in any ways? Once you've determined where your routine is weakest, make a plan to address that area specifically. Brushing and flossing. Brushing. It is essential to brush your teeth and floss to prevent gum disease. Brushing ensures the removal of plaque, which is the primary cause of tooth decay and gum disease. It arrests the buildup of any plaque formation. You should brush your teeth for at least 2 to 3 minutes twice a day. Flossing. Dental floss is an effective and easy-to-use tool that can be among your best defenses for preventing periodontal disease. A buildup of plaque and bacteria causes periodontal disease. Dental floss is effective at cleaning areas where your toothbrush cannot reach. Small gaps and tight spaces between teeth catch food debris and sugars and acids from drinks all day long. Flossing helps to clean out these tough-to-reach areas. Brushing techniques. Brushing one's teeth with fluoride toothpaste is a straightforward, generally recommended, and commonly practiced dental care technique. Tooth brushing, when done correctly and regularly, can help reduce plaque, which includes germs linked to gum disease and tooth decay, as well as give the cavity preventive effects of fluoride. Some effective brushing techniques that allow you to clean all the surfaces of your teeth are described next. Remember, brushing will not clean the interproximal areas, the space between the teeth occupied by the gum. Base brushing technique. The base brushing technique is used to remove plaque next to and directly beneath the gingival margin. Procedure steps. Grasp the brush and angle the bristles at a 45-degree angle, with the bristle tips pointing directly into the gingival sulcus. Vibrate the bristle tips back and forth with short, light strokes for a count of 10, allowing the bristle tips to enter the sulcus and cover the gingival edge. Lift the brush and go on to the next area or group of teeth until you've cleaned all of them. The brush's toe bristles can be used to clean the arch's lingual, tongue, anterior section. Charter's brushing technique. This brushing technique is used to loosen plaque and debris, and to stimulate both the marginal and interdental gingival. Procedure steps. Grasp the brush and place it so that the back of the head is directed apically toward the end of the root, with the bristles placed downward on the maxillary and upward on the mandibular. The bristles should be placed over the tissue where the tooth and gingiva meet. Press the bristles into the space between the teeth. Vibrate gently back and forth while maintaining this position and count to 10. Reposition and repeat the technique for each subsequent area. For anterior areas, hold the brush parallel to the teeth and use the sides of the toe bristles to clean the area and count to 10. Modified Stillman brushing technique. The modified Stillman technique is designed to do a good overall cleaning, remove plaque, and stimulate and massage the gingival. Procedure steps. Place the toothbrush so that the bristles are pointing apically and the handle of the brush is level with the biting surface of the tooth. Rotate the bristles downward and vibrate back and forth until the brush has rotated over the entire surface of the tooth. Do this motion slowly and count to 10. Repeat this motion over the same area at least 5 times. Continue until each area and every tooth have been cleaned in this manner.